Hi, my name is Ethan Barton. I'm a student at the University of South Alabama in the nursing program. Here's my ID. And then today I'm going to be performing my urinary catheter insertion checkoff. First we scan the room. Then I'm going to get my patient care order form. And I'm going to look at hospital policy for insertion of catheters. And then I'm going to perform hand hygiene before I touch my patient. Look at the armband of the patient. I'll identify them using two identifiers: Jaguar Jones. Jaguar Jones. Her birthday is 8/25/1963. 8/25/1963. Mr. Jaguar Jones. Today I'm going to be performing a catheter insertion on you for urine output. I'm going to assess any allergies. See he's allergic to penicillin. His armband says he is allergic to penicillin. Then, so 3 justifications for the catheter are it's required for immobilization, for surgery, trauma, and other therapies, strict urinary output monitoring as indicated by his plan of care, as well as acute ventilator-dependent respiratory failure. Next, I'm going to gather my equipment. I have it all here. Sterile gloves ready to put on, stat lock. And then I'm going to don my goggles. Provide privacy for the patient. I'm going to position my trash can and then perform hand hygiene once again. Next, I'm going to raise the bed to working height, and then I'm going to lower the side rails, as well as put the patient in a comfortable position in the dorsal recumbent position with the legs bent. Like so. This one doesn't want to bend, but that's okay. Next, I'm going to open my kit. Between the patient's legs, we're going to use this as a separate trash can. By the patient's hip, like so. Going around the sterile field here. Now I'm going to don my sterile gloves. First, I would provide, before I open the sterile kit, I would provide perinatal care to the patient using soap and water. Start for our patient here is a female, we start outside the labia, moving inwards, and then for male, we would start around the urethral meatus, and we would, circular motions, we would go around 3 times at least, and then move on to the shaft of the penis and the scrotum. Next, now I'm going to don my sterile gloves. Now I'm going to remove my sterile field. The shiny side down. Then I'm going to remove my tray onto the sterile field. I would then spray, I have swabs, so I don't have to use any iodine on cotton balls, but you might have to do that. And then I would get my lubricant, put it in my tray for catheter insertion, and then have my syringe. And now I'm going to my swabs, and I'm going to separate genitals around the labia, and then around your urethra. Next, I'm going to remove the plastic from my catheter. This is all sterile, so it's good here. Then I'm going to lay this in the tray for lubrication. 1 to 2 inches of lubrication for females and 5 to 7 for males. And then I'm going to get my syringe. And I'm going to attach that to my catheter. Then after I've lubed up my catheter, I'm going to instruct the patient to bear down as I'm folding and take a deep breath before I insert, and then I will insert into the urethra until I see urine flow, and then I'm going to insert 1 to 2 more inches. Then grasping it with my non-dominant hand, I will fill this balloon up with my syringe. Then maintain pressure. Remove my syringe and place that here for later. Now, this is a shoebox that we were dealing with, so there are some difficulties making sure that it does not pull my box over. So I would pull on the catheter to make sure it is snug, and then I would insert 1 to 2 inches back inside the patient. See if we can get this here to stay. Okay, and then next I'm going to demonstrate how I would properly attach the stat lock to the interior of the patient's thigh. I would remove this sticky part right here, put on the patient's thigh, and then I would put the catheter inside the lily lock in the, well, if I can get it open. And I would place it in here like so. And this would ensure that there is no trauma to the urethra on the patient's thigh. Next, I'm going to, I would normally put the bag on the bed frame, but today I'm going to try to make sure this shoebox does not fall over. The catheter will not be moving because it has this, it's attached to the stat lock, which is on the patient's thigh. But I'm going to place this on it. Come around so you can see if you want. Try to get this one uncooled as possible so it'll stay. But then I would place it below the bladder height onto the patient's bed frame, not the side rail, like so. And this makes it easier for specimen collection. Come on. All right. Next, I am going to demonstrate how I would collect any specimens. Ensure that I have goggles on just in case it splashes. I would remove the cap, place it on my tray, and then down here, place it on the floor on top of a towel, and smooth this down a little lower on the bed frame. Hopefully we don't pull the patient. And then I would take out the drainage hose and be careful not to touch it. Also, do not touch it to the outside of the container. and normally have a bigger container, and this is also would be closer to the floor. And then I would make sure that it's there. I would open the valve, fill it up, and then close the valve when I'm done. Then I'll clamp this back, put the clamp back on, and then back into the bag like that. Get my specimen, and carefully without touching the inside of the cap, put back on. I would label the container, not the lid, and then I would take this tube for examination in the lab. Next, I'm going to next I'm going to discard my equipment. I would put this, you normally place this above, drop this above waist height to the trash can. I'm actually going to leave this here because we need this for discontinuing the catheter. But I would normally throw away all of my equipment, correctly remove my sterile gloves, downward towards the trash can. And rub gloves skin to skin. And next, I'm going to put the side rails back up, lower the patient, put them in a comfortable position, and then I'll lower the patient down to its lower the bed down to its lower setting. I have the side rails up. I would ensure that the call light is in reach, and also any necessities for the patient are within reach, and so they can call if they need assistance, and also they don't have to get up to get anything. Then I'm going to perform hand hygiene. After I've done this, I'm going to describe some of the things I would document for the catheter insertion. So I document the catheter size, the amount of urine that came out, the color, and the consistency of the urine. I would also document the patient's reaction to the procedure, as well as the specimen collection if it was required. Now I'm going to talk about daily catheter care I would provide for the patient, which would be with soap and water around the urethra. This is again, as I said, this would be daily. And then also plan to remove the catheter as soon as medically indicated. Next, I'm going to show how I would discontinue the catheter. I would normally put on clean gloves for this, and then I would come over here to the catheter. I'm going to put this bag a little higher up so it's not pulling on it. I would come here and I would clamp. Oh, first I want to show how I would collect the specimen if I did not use this cup out of the bag, but instead I took it from the drainage port, right here. So normally I would clamp this, and then using my syringe, this is after it's been in for a while, then I would get this syringe and you would draw out the urine as indicated, and then unclamp before you leave your patient. Next, now for discontinuing the catheter, make sure I'm wearing goggles again, and then I'm going to grasp the catheter in my luer lock syringe. Make sure I have 0.5 milliliters of air, and I do. Going to insert this into the balloon attachment, and when I do that, gravity is going to, and pressure gradient is going to remove the saline from the balloon. And that is all. Ooh, and then normally it would still be in here, but then I would slowly pull out. And then I would properly, I'd make sure that I document the amount of saline that comes out, and then I would properly dispose of the catheter and the urine in the trash can, remove my clean gloves with it. Next, I'm going to provide perinatal care for the patient after removal of the catheter. And now I'm going to discuss the documentation for the catheter removal. I would document the amount of urine, the color, the odor, and the consistency, as well as how much water was removed from the balloon, as I just stated, the patient's tolerance to procedure, as well as any teaching points such as some signs and symptoms of the UTI, which would be frequency, urgency to urinate, when pain when voiding, as well as overall pain when urinating. Also, I'd come back to assess the patient 4 to 6 hours later, see if they're voiding. If they're not, then I might palpate the bladder, as well as order a bladder scan. And then lastly, I would verbalize the plan to discontinue the catheter if need be, with any medical conditions regarding the patient. And that completes my catheter insertion checkoff.